Hello, I'm Robert Kushner, Professor of Medicine at Northwestern University Feinberg School of Medicine in Chicago, Illinois, in the United States. Welcome to this program titled COVID-19 Pandemic, Implications and Coping Strategies for the Patient with Obesity. Joining me today are Paolo Sabraccia, Chief of the Internal Medicine Unit and Obesity Center at University Tor Vergata in Rome, Italy, Christoph Spinner, Specialist in Internal Medicine and Infectious Diseases from Technical University of Munich in Germany, and Michael Vallis, Health Behavior Change Consultant and Associate Professor in Family Medicine at Dalhousie University, Nova Scotia, Canada. Welcome. We are in the midst of a global COVID-19 pandemic, which is the most significant public health crisis we have faced in generations. New information is emerging every day and every week about the risk factors for hospitalization, admission to the intensive care unit, need for mechanical ventilation, and death. All of us are facing challenges at this time, including healthcare workers and all of us who are practicing social distancing. There's a particular challenges for patients with obesity and those involved in their care. In this program, we'll explore some of those challenges and offer some practical guidance. Christoph, I'd like to start with you. Can you please give us some background and update us on this new virus?
Well, thank you. I'm very happy to share some insights about the severe acute respiratory syndrome coronavirus 2, which belongs to the family of RNA viruses and has a huge 29 kb genome. From all what we know so far, it is very likely that it is a zoonosis that has been transmitted from bats. First cases have been reported in Wuhan, China, by December 8th in 2019. The novel virus was identified and completely sequenced by January 7th in 2020. And the worldwide situation at end of April 2020 is continually challenging and changing. Many up-to-date information is available on several web pages, such as those of Johns Hopkins University COVID-19 dashboards. And currently several trials are ongoing, including remdesivir, bevacizumab, tocilizumab, immunoglobulins, hydroxychloroquine, thalidomide, many HIV drugs, as well as steroids, and many others.
Christoph, at least in the United States, I'm sure globally as well, we're using a lot of plasma for immunoglobulins. Has that been particularly helpful in this patient population?
So using plasma from people that completely recovered from COVID-19 disease is a challenging option that is undergoing several trials to find out whether it would be a valuable treatment option. And we started to get some own experiences with that a couple of days ago.
Yeah, I hope that helps as long as the other treatments that you've talked about and a vaccine, I hope that will be available in a year to a year and a half. But Christoph, what are some of the most common symptoms that patients are presenting with?
Well, there's several symptoms COVID patients are presenting at the medical systems and with their doctors. 9 out of 10 people do suffer from fever. The majority is reporting shortness of breath and coughing. Headache and muscle aches are very common, sore throat, and the loss of taste or smell is also very common, but especially the unexplained loss and taste of smell comes up after a couple of days of the infection. A minority of patients is presenting with GI symptoms such as diarrhea, which is 5 up to 10%.
Yeah, chest pain, I think, is also now starting to emerge. People talk about this intense pressure that they're having. So it's interesting as multiple organs are being involved. We think of it often as a respiratory disease, but it's very clear now that's affecting multiple organs, which leads to a variety of presentations.
I would clearly agree on that. So it is a systemic disease and not just the lung being involved in SARS-CoV-2 infection. And we are currently learning much more about the several organs being involved, and much more research is being published every single day.
So we know from the data that older individuals with pre-existing conditions like hypertension, cardiovascular disease, diabetes are at increased risk. So we're looking out for those. But what do we know about patients with obesity? Are they at increased risk as well?
There is also some evidence of diabetes and COVID-19, because there has been recently a meta-analysis of 6 different Chinese studies being published reporting the incidence of diabetes in COVID-19, including more than 1,600 individuals for that analysis. And the rate ratio of more severe versus less severe infection of COVID-19 in patients with diabetes is 2.26, clearly indicating that there is an increased risk of severe COVID-19 disease in diabetes. But there is also more to know on obesity and COVID-19. There is another cohort with more than 4,000 individuals from COVID-19 subjects in New York City. Almost every second person being hospitalized, 49% of those being discharged, and approximately 15% died or sent to hospice. And what was found there is that the risk for hospitalization is mainly age above 65 years or older, body mass index above 40, or known and documented heart failure.
So it sounds like we clearly are having emerging information similar to the H1N1 flu in 2009, that obesity is an increased risk, which is interesting, and I'm sure we're going to learn more and more. Paulo, why don't you talk a little bit about what we know about the reasons that patients with obesity may be at increased risk? Now, we know particularly those with abdominal obesity have metabolic dysregulation and increased systemic inflammation with cytokines and adipokines and so forth. Is that what's underlying the problem here with obesity?
As we know, obesity is characterized by macrophage infiltration in the adipose tissue and the so-called meta-inflammation that basically raise the inflammation of the body. This is certainly related to different distribution of fat, so we should talk about obesities rather than obesity as a whole. But certainly this dysregulation of the immune system might, in one hand, being able to raise the innate response to the viral attack, but as a matter of fact, the data point to a blunted and reduced antiviral response in the obese individuals. This is certainly a matter of discussion. What it is not, I think, a matter of discussion is that once the obese individual get infected, the maladaptation of this increased inflammation causes a worsening of the disease at the lung level, and pose obese individuals at increased risk of the worst of the bad outcomes and or death. So this is the reason why, in fact, immunosuppressant like tocilizumab or like hydroxychloroquine are used, and probably corticosteroid also, and probably for the obese individuals, this has to be taken into account much more due to the pattern, of inflammation.
Mm-hmm. Boy, it raises a whole other concern for those in outpatient. Those of us in outpatient practice, we always think about the metabolic dysregulation and systemic inflammation for these chronic, relapsing problems. It really brings to the forefront the importance of that underlying dysregulation in fighting off an acute infection. It's really quite alarming, I think, for all of us who are caring for our patients.
Yeah, sure.
Paulo, let me turn to you, though. So what are some of the particular challenges in caring for patients with obesity? For example, we're using proning a lot, really around the world, and we always know that individuals with obesity, particularly abdominal obesity, have a respiratory compromise, reduced compliance, increased workup breathing, and so on. That seems to be quite a problem for these patients. What do we know about that?
Yeah, absolutely. First of all, I'd like to point out that data from a group of intensive medical care in Milan have somehow demonstrated that this SARS-CoV-2 is not the typical acute respiratory distress syndrome. And in fact, they noticed that by pronation, they didn't really get, the redistribution of ventilation in the upper lobes, but they get, in fact, an improvement due to the vascular diffusion that is certainly related to the microthrombotic events that may happen during the COVID pneumonia. For the obese individual, this is certainly a much bigger problem for several practical reasons. First of all, the majority of patients were male, and we can imagine male obese individuals with, an increased waist, so pronation in those individuals certainly is not easy. And also, if the individuals weigh too much, it is probably extremely difficult to prone them. And so this will make these individuals, without getting this opportunity to improvement of the ratio, the so-called PF ratio. Also, during the normal position, you need to put the patients at 45 degrees in order for the abdomen not to push too hard on the diaphragm. So there is a lot of concerning that altogether, again, pose the obese individual an increased risk when they are once they are admitted in intensive care unit.
Yeah, so this really highlights the importance for all of our intensivists to be aware of the specific issues related to obesity, things that we often think about in the outpatient setting, but here in the inpatient setting becomes even more important to be aware of.
Absolutely.
Yeah. Paolo, so patients with obesity and the chronic care treatment have many other comorbid conditions, as we've already talked about. What are the other things we need to be thinking about as healthcare providers as well as patients regarding use of medications and keeping them well?
Well, one thing that need to be pointed out is the fact that when we look at the data on the published paper, we see that the comorbidities are differentiated in percentages: obesity, diabetes, hypertension, but then we know that they overlap because many diabetic and hypertensive individuals are in fact obese, and those are complications of obesity. One thing we know from the literature and from the practical experience, I would say that uncontrolled diabetes, it is certainly a risk for developing any infectious disease, and including pneumonia. And therefore, a suggestion and a warning also for the general practitioner and for the one that cares for diabetic individuals, that in obesity, in particular, for all what I said, it is extremely important to maintain a good glycemic control. Glycemic control is extremely important, and for all diabetic individuals, maintaining it in a safe range will lower the risk of infection, including pneumonia, and we know this for several reports. And for obese individuals, this become even more important, and therefore I really would suggest the GPs and the patient themselves to really be adherent to therapy and to control their glycemic, their blood glucose, in order to maintain it as tight as possible in order to stay on the safe side. Another issue that I think it's important to raise is the one related to the use of ventilation at home, CPAP, for sleep apnea that is highly prevalent in obese individuals. So in one hand, obese individuals tend to have the hypoventilation syndrome, and so adding, critical conditions to the one related to the COVID infection. So it would be extremely important for them to adhere to the good practice of using CPAP at home. But on the other hand, I think it's extremely important to give information about isolation, because the CPAP could be a vehicle of dissemination of the virus if the patients have got the virus. So in one hand, it's important to be adherent to the CPAP usage. On the other hand, it's extremely important that within the household, obese individuals know how to isolate when using the CPAP.
Yeah, Paolo, let me ask you one other thing, is that we know from this virus it uses the ACE2 receptor in order to enter the cell. A lot of our patients with obesity are on ACE inhibitors or ARBs for blood pressure control. Is there any relationship there? What are we understanding about the interference, either increasing risk or reducing risk by using an ACE inhibitor?
Yes, this is another of those situations in which, we have the two sides of the moon. In one side, we have to consider the fact that the virus bind to the IC2 protein expressed at the lung levels, and by doing this, it downregulates the protein. And this is a protein that has a protective role on the vasculature. Okay, since AC inhibitors and ARBs upregulates the ACE2, you may imagine two situations. In one situation, you might hypothesize that the usage of these antihypertensive drugs may increase, by increasing the ACE2 expression, would confer a higher risk of infection. And on the other hand, however, you might imagine that by using these drugs, actually, you protect the vasculature of the lungs because you upregulate this protein. So concern circulated about the usage of this drug. The major hypertension society in the world and the American Heart Association, the European Cardiology Society said that everybody with stable hypertension should continue these drugs. And they did good things, because as a matter of fact, just a few days ago, came out a nice report from on circulation research that actually demonstrated that those on ICE inhibitor and ARBs were somehow protected, and the mortality rate in these individuals were lower as compared to the other. So the bottom line is certainly we have to understand more, but for now, I think continue and maintain this drug to treat hypertension and maintain the best values of blood pressure as possible.
Okay, good. Thank you. Thank you for that update, Paolo. Christoph, what's the most important thing we can do to help our patients and their families stay well during this global epidemic?
Well, there's major things to do. Hand hygiene and social distancing is one of the most important things to do. That means washing the hands once you have been out of your household, using public transport or being for shopping or daily mall things. Using, single tissues once coughing or sneezing and discarding them afterwards. Avoid coughing and sneezing in your hand. Also, keep distance to others of at least 1 to 2 meters. And what is one of the most important things to do is stay at home whenever you are ill. Disinfectant and cleaning surfaces quite often might also help to reduce the risk of transmission. And one other thing that is also important is the use of face masks. And there is several recommendations from the ECDC or also CDC on masks to use. And then the majority, there's 3 categories: community masks, medical masks, and respirators. And community masks is, from all what we know, might be a valuable option to reduce the likelihood of transmission. They should be washable with at least 60 degrees Celsius or more, which might help to use disinfecting them or keeping them clean. So having several masks at hand might help providing additional protection.
Paulo, I want to come back to you one more time, and that is, what are other things that we should be thinking about as clinicians, as well as talking to our patients, to prevent or lessen the intensity of the infection?
I think that altogether we should tell the patients who are at higher risk to follow all the things that Christoph just said. And so in particular for the obese individuals, they should follow all the cleaning hands protection. If they have comorbidities such as type 2 diabetes, such as hypertension, to really be precise in controlling, taking all the drugs and all the medicine, especially in a period in which in certain area of the world it's difficult to get in touch with the doctor, or maybe you get in touch via a telemedicine platform or whatever. So these days, I think it's extremely important to maintain, all the nutritional suggestion, all the healthy suggestion that you can make. The obese individuals are overall, with the exception, because it's a huge word, are fragile individuals. And we know that frailty is the major risk factor for the bad outcome of the COVID pandemic. So this is extremely important to stress.
All right, thank you very much. I'm going to switch gears a little bit. We've talked about the hospitalization and ventilation and death and increased risk and the symptoms and so forth. I want to switch gears now, which I think is equally important, and that is about all of us and all of our patients who are asked to stay at home and do social distancing, or we call physical distancing. We know that alone can result in coping problems, stress eating. We know that physical activity is going to be bad for our immune health, as well as potentially increase obesity as well. There's also data that social isolation can be worsen our health independently, just from the psychological issues of what is going on. Michael, I'm going to turn to you for a lot of this information, being a behavioral health specialist. What do we know about the stress response and how people respond to these kinds of challenges, which I don't think any of us have really experienced before?
As a health psychologist, what I would really want to communicate is that if we can help people understand what they're experiencing and encourage them to engage in active coping, then what we can do is we can help them to maintain the distances and the behaviors necessary to keep risk low, and at the same time try to achieve the medical outcomes that we're trying to achieve with good diabetes management, good weight management strategies. But I think the first point to make is that humans like routine and pattern and have a preferred lifestyle. And pretty much all of us have had that impacted. So this is not normal. So we would all have a stress response. And so I think the first thing we would want to do is encourage us to accept that all of us might be at risk of experiencing stress. And stress is a very profound, fundamental body response. It's really the body gearing itself to action. And so all of the body systems get engaged in the stress response. And it can have both positive, because it can be very activating, but also negative impact. And so when we look at stress, what I would encourage us to think about with our patients and even ourselves is what are the sort of emotional impacts. And many of our patients living with obesity have developed activities. They've developed coping strategies that work for them. So many of our patients are engaged in obesity management interventions, but maybe those are now completely interrupted because of the physical distancing. And so when we see our patients, so for the physicians who would be screening patients, just be aware of anxiety. Perhaps the patient is experiencing threat, the sadness, the person is experiencing loss, or irritability if they're experiencing this intrusion, because then what we can do is link the stress to the coping response, which would be the sort of, in a way, the part two. And it's kind of what am I feeling and what can I do about it are the two questions that as a health psychologist, I would encourage the physicians to be asking the patients these questions.
And what are some of the particular challenges for people with obesity who are facing stress and social isolation? Is there something unique as a healthcare provider I should be looking for or helping to support my patient who is suffering from obesity?
What we're really talking about here is what could you as physicians, we all recommend to patients. And there are sort of general coping strategies, which are ways of reducing that stress response. And they fit into a number of categories: physical activity, physical calming, emotional expression, social support, and sort of acceptance. Those categories of strategies are all demonstrated as evidence-based. And what we know is the coping strategies that work for people are ones that make sense to them. So as physicians, you don't have to know what the coping strategies are for your patients. You can ask your patient, what is it that you can do that you can find helpful? And those can be strategies that fit into any of those categories. The more, the better. So coping strategies are really additive. I often encourage patients to think about what can you do in 5 minutes? What can you do in 30 minutes? Because coping strategies, particularly under the kind of stress that people are having today, they may need to sort of cope on a fairly regular basis. Now let's talk about obesity, where there may be some specific challenges. And so what I would encourage us to ask our patients is the following. Is there anything about living with obesity that's easier since COVID? Because maybe it's not all bad news. Many of our patients say, my lifestyle is such that I really can't make meals from home. I really find that I'm so busy that I have to use, processed foods. I have to access drive-thrus. But now maybe they have time. Now maybe they, in fact, can re-examine their relationship with food. And so there could be some potential advantages. So we could ask our patients, is there anything that you're finding any easier? And then what are you finding challenging? And then we can engage people. And so then we start to help the person figure out what can you do? And this is where, very basic behavior modification. So again, not a complex psychological intervention, but a very basic behavioral intervention, which would be if our patients are struggling with access to food, if they could try to be careful about their shopping. So if you have foods that you have trouble controlling, highly tempting foods, the best thing you can do is eliminate access to those foods. So, the idea of, I'll just keep it in the fridge and I won't eat it doesn't actually work really well. So the way you shop for foods, try to bring in the foods that you feel would be more likely to support your health. And then very basic behavioral strategies like try to minimize snacking. So have your meals at a table, set the table, sit down at the table, don't text, don't read, don't watch Netflix during the table, make it eating a sort of an isolated event. And then importantly, if you've lost your coping strategy, so let's say you were part of an obesity intervention program and now you can't access that. Self-management is a very important aspect of the medical management of any chronic condition. So ask our patients, what do you know already and how can you capitalize on this? One of the things that I really like about being a psychologist is that you not only help people with their problems, but you also can help learn from your patients all of the things that they are really good at doing. So trying to tap into the sort of empowerment side. If you had a friend who was in this situation, what would you be telling your friend to do that would help them manage their eating? Or that would continue if you found that the social contact of being part of an obesity treatment program was really helpful. Is there any way that you could resurrect that? So in essence, trying to sort of look at this in the perspective of, yes, we're stressed. Stress can interfere with self-care. Stress management will be the strongest way of moderating that effect.
Thank you, Michael. That's a great overview, great insight, and great tips. I've been doing telehealth for the past month, like many of us have. I've witnessed and heard exactly what you're talking about. I want to underscore the importance of patients developing a structure and a schedule every single day. I want to add that their sleep habits and sleep hygiene need to be emphasized, getting adequate sleep, remaining physically active, which also increases your immune response, as well as feelings of being well, and also unplugging from the social media and the 24/7 TV that people have access to, and to de-stress that way.
Those are excellent. Yeah, I completely agree.
Well, we've talked a lot about in this session. We are in the midst of a global pandemic, which is the most significant public health threat I think we've ever seen. We are now aware that individuals with obesity are at increased risk. Michael also just reviewed the prevention areas of self-care, of social distancing, and using good hygiene. Paulo talked about good glycemic control and continuing to use our ACE inhibitors. And if patients are using CPAP at home, be careful of the aerosol problems. And practice guidelines regarding managing stress and behaviors while maintaining social distancing. I'd like to thank my colleagues, Christoph, Michael, Paulo, and thank all of you for this great discussion. And I want to thank you for participating in this activity. Please continue on to answer questions that follow and complete the evaluation. Thank you.